The new NICE guidelines, they are really a step forward for the treatment of patients. So the implementation of neoadjuvant treatment and immunotherapy, I think this is going to be a great step forward, and with improvement in the result of the treatment in patients. However, the downside is that this implies very complicated logistic changes in the clinical settings, not only the clinical side, but also in the labs. And maybe where I work, which is the lab, we have to, the problem that we are having now is that we are short-staffed, and this is going to suppose an increase in workload. However, we have to work towards this because at the end it's the patient who has to, improve. Overall, we have to work towards the treatment and the improvement of the patient and his life, and so even though it's not going to be easy, we are working hard towards that. The way we work now is that we do in the lab, in histology lab, what we do is we treat the tissue and we make the diagnosis, we study predicted biomarkers. However, all about molecular studies, they have to be sent to the GLH. My understanding is, or we have a good communication, or we should work, in the same place, because as the molecular biologists, they understand and they do their work with the tissue. We are the ones that are specialists, and we are receiving the tissue and we treat the tissue. So in my view is that we need to work together. We have to improve the communication, and the same way that we are interested in the tissue, we need to improve the way we understand molecular, because that's the only way just to improve the results.